Next, let's take a look at LARCs, L-A-R-C. LARC stands for long-acting reversible contraception. LARCs are IUDs and implants reported to be very effective for preventing pregnancy. IUDs are devices inserted into the uterus. There are 3 that are currently approved in the United States. The 2 levonorgestrel-releasing T-shaped IUDs, known as Mirena and Skyla, and the copper-containing T-shaped IUD, known as Paragard. These are approved for 5 to 10 years. They are considered by the American Academy of Pediatrics to be safe and effective methods of contraception for adolescents. We will discuss later the risks of steroid hormones released by the IUDs, Skyla, and Mirena. But here I want to note a risk that is not often explained properly by medical doctors inserting these devices. The devices are T-shaped and are inserted into the uterus. The problem is that they don't always stay in the uterus. There is a tendency for them to migrate and penetrate the uterus and then move to various parts of the body where they can cause pain and injury. Mirena is marketed by Bayer, and the first lawsuits were filed in 2011. Women are claiming that they suffered great pain and that they have suffered injury to other organs and that they have had spontaneous abortions. It requires major surgery to remove these devices once they have migrated. And so if Mirena wasn't a big enough problem, in 2013 Bayer got another approval to market Skyla. Skyla is only a couple of centimeters smaller and only has enough steroid hormones to last for 3 years instead of 5. But still, it has the same potential to penetrate the uterus and migrate. Implants. The progestin implants are Implanon and Nexplanon, and they are both single-rod implants that contain etanogestrel, which is the active metabolite of progestin. These may remain in place for up to 3 years. The implant is inserted by a clinician inside the patient's upper arm. So these LARCs are the most effective artificial birth control. Once implanted or inserted, they have perfect and typical failure rates of less than 1%. That means that only 1 woman out of 100 will get pregnant each year. But important questions are, what are the risks and complications of these hormone methods? What are the side effects? What are the long-term effects?